Hello, everyone. We're just giving a couple minutes for everyone to arrive here. I can see that people are coming. And now I just want to introduce Nola a little bit. A lot of you know her, but it really is impressive just to see all the things that she's involved in. So join me in welcoming Nola. Let me give a little intro to her and then I'll hand it over. So Nola Peacock is an outpatient physical therapist and the lifestyle medicine clinical coordinator here at St. John's Health in Jackson. She's a board certified geriatric physical therapy specialist. She's also a board certified health and wellness coach and a board certified diplomat of the American College of Lifestyle Medicine. She serves as an ambassador for the National Osteoporosis Foundation and as a geriatric physical therapy advocate here for the state of Wyoming. In her clinical practice, Nola specializes in the treatment and prevention of chronic lifestyle-related conditions using physical therapy intervention and health coaching. So Nola, I will let you take it away.
Thanks, Beth. It is so great to be here with all of you for this encore presentation of Boost Your Bone Health. As Beth mentioned, I'm a physical therapist, and this is one of my areas of specialty and one of my absolute passions. I could talk about bone health all day long, so I won't do that for you today, but we will go into some detail about bone health, and I'm happy to answer questions at the end. So if we were in a live session, I love to take questions as we go along. You'll just have to be patient and plug those into the Q&A as we go. What I want to set the stage first about is there are several different diagnoses and things that we will talk a little bit as we go on ahead, talking about bone health and how it's important to you. But I want to reframe your thinking just a little bit, that yes, we're talking about bones and the bone health, but what we are really talking about here is fracture prevention. And I'll get to more details on that as we go along. Beth, you can forward the slide. So we live here in beautiful Jackson. It's July finally, and it is just gorgeous. We tend to live very active lifestyles here, which is fantastic, but it also presents some problems a little bit for our bones, that we want to keep them strong and healthy so that as we're active, we are as well and functional as possible. We like to do lots of fun things indoors and outdoors all seasons of the year. And that's really where I think my thoughts go to about how do we keep doing all the things that we love to do and do them safely. Next slide, please. Thanks, Beth. So this is a great graphic that is actually a little frightening at first glance. So just take a deep breath and walk through this here with me. On the left-hand side of this graphic is what we would consider normal bone density. You can see that there are places where there's less bone material, but there is a lot of bone material in this slide. If bones were completely solid, if all of those air pockets were completely solid, we would not be able to move our bodies at all. So the airways and the kind of the empty spaces in the bone are strategic. That makes us able to move our limbs. That's normal. However, as we progress across to the right-hand side of the slide, you can see that there's more and more and more air spaces and less bone material. Healthy bone is on the left side. In the middle is what we call osteopenia, or low bone mass. Further to the right is osteoporosis. The World Health Organization defines osteopenia. If you've had a DEXA scan, you'll see your numbers. Minus 1.5 or minus 1.0 to minus 2.5 is considered osteopenia. And beyond minus 2.5 is osteoporosis. So if you've happened to have looked at your DEXA scan to see the health of your bones, those are the numbers that we're looking for. And they help us to grade how much bone material is present. And that sets us up a little bit to talk about our fracture risk as we go forward with our active lifestyles. Next slide, please, Beth. So I framed this out a little bit about, yes, our bone health is super important, but what we're really focused on here is how do we keep our bones from fracturing? There are two very important fractures that we need to discuss. The first one that you see here is a hip fracture. And those of you that have had your DEXA scans before, you know that we look at 3 different places in our bones to measure the density of the bone material in those spaces. The first place we look is in the hip. Hip fractures often happen, as shown as in this graphic, kind of at the femoral neck is what we call it, the angle between the ball and socket and going down to the leg. I hate to be the one to share some sort of scary news about this, but hip fractures are not only painful, but they are life-changing. They can really be game changers. The statistics are quite frightening. A woman over the age of 65 that fractures her hip, 20 to 30% of those women will die within the next year. And 60% of those women that don't succumb will never return to their prior level of function. So hip fractures are a really, really big deal. So maybe if you don't remember anything else from our discussion today, I want you to be respectful of hip fractures and why I keep talking about prevention, prevention, prevention when it comes to fractures. The second fracture that oops, you can go back, Beth, sorry. The second fracture that we're really concerned about are what we call compression fractures, and those are in the spine. So the other place that we measure the bone density in the DEXA scan is in the lumbar spine. Many of the compression fractures, however, happen in the thoracic spine as well. So you can see on this graphic here that instead of being a nice kind of square-shaped vertebrae, the bone in our spine, the front part of the bone compresses and it becomes wedge-shaped. And if we have one of those, we're at risk for another, and we just add and add and add to those, and our spine curvature increases. Now, a compression fracture is very painful, and it's a lot to recover from. The mortality associated with it is less than a hip fracture, but it does decrease our function. It can impair our lung capacity as well as our digestive system if the curvature is so extreme that we are folded forward. Many of you are familiar with what that posture looks like. So those are the two biggies that we want to prevent. Beth, go ahead. So that's the problem. So what's the solution? That's what I like to talk about, is what can we do about this? The solution, without a question, is prevention. We want to intervene with bone health that is maybe a little lower mass than it should be now before there's a fracture, and reduce that risk. So some of the ways that we do this in a clinical setting is medications can be very, very helpful. That's not the purpose of our conversation today. Have that conversation with your healthcare provider. There are some medications that help to build bone, and there are some medications that slow the loss of bone. So there are different options there, and they're really very important to understand and how they play out for risk reduction for fractures. Another area that's really important that we won't get too deep into today as well is nutrition. So calcium is a very important element. There are lots of different elements in our bones, but calcium is one of the big pieces of the material in our bones. Our bones serve as a calcium storage bank for the rest of our body. Every muscle in our body, including our skeletal muscle, the muscles in our legs and our arms and our trunk, as well as our heart muscle, require calcium to contract and to do their jobs. So without enough calcium, we're in big trouble. So our body pulls calcium from our bones if we're not getting enough nutritionally in our diet. The recommendation for postmenopausal women is 1,200 milligrams a day. For men in that same age range, it's about 1,000 milligrams a day. So I challenge all of my patients, and I'll extend that challenge to you, to track your calcium intake. Ideally, we want you to get it in your foods first. That's easier on your digestive system. That's easier on your kidneys and everything else. It's best absorbed that way. So track your calcium. You might have to do some Googling to get the content of calcium in the foods that you eat, and aim to get 1,200. If you find that you're coming up short on your calcium, that's the time to supplement. But if you're getting enough in your diet, you won't need to supplement. Other important nutrients are vitamin D3. We generally recommend somewhere between 2,000 and 5,000 international units a day. Protein, though it's not a supplement, it's a very important element that we need to make sure that we get enough of. As we age, and by that I mean probably after about our 40s, we don't assimilate protein quite as easily from our diet. So we need to make sure that we're getting enough. And a registered dietitian, we have those here at the hospital that could work with you individually to help you calculate your individual protein needs. There are other elements, boron, vitamin K, and that's, again, individualized conversation and prescription through your healthcare provider. So another solution to preventing fractures is if we can prevent a fall, we very likely are preventing a fracture. Now, we can't prevent every fall, right? When the walkways and our stairs and all the places that we are out in the winter are icy, sometimes those falls happen so quickly, prevention doesn't have a chance. But there are a lot of other falls that we can prevent around our homes with the surfaces that we're walking on, getting throw rugs out of the way, improving our balance with activities that strengthen our muscles and improve our response to getting a little bit off kilter. I will just give you a little side tip. Some of the best research forms of activity that improve our balance best are Tai Chi, and we have a Tai Chi class at our senior center and one at our rec center, and pretty much any form of dance, everything from ballroom dancing to square dancing. So have fun with that one. I would also note too that proper footwear is extremely important for fall prevention. Wearing good shoes in the winter, very, very important, but also year round. Crocs and flip-flops don't really fit the definition of proper footwear for preventing falls, so be a little careful with those. And then finally, exercise, which is where we're going to spend a lot of time today talking about, that there are particular types of exercise that we know help to improve our bone health, reduce our fall risk, and can help us to be more active longer without fracture. Beth, please. So what I would like all of you to do, as long as you're not driving, which you shouldn't be driving if you're watching a webinar, but everybody go ahead and stand up. And if there is a wall nearby you, I would love for you to stand up against the wall with your feet maybe 12 inches away from the wall. So back up against the wall, let your feet stand out in front of you just a little bit. As you are standing up against the wall, you should feel 3 places touching that wall. You should feel your backside, your buttocks. You should feel your shoulder blades. And importantly, you should feel the back of your head against the wall. So usually when I'm working with a patient, they get the first 2. They get their rear end and they get their shoulder blades. The head is where we sort of start to see this, what I call forward head posture. And a few minutes ago, I was talking about compression fractures in our spine, and that sets us up for this forward folding posture. And I know all of you probably have seen older adults that are very flexed forward and couldn't possibly get their head on the back of the wall. Work on this so that you can have your head on the back of the wall. Very, very, very important. I'll give you kind of some tips on this here as we go along in a little bit more detail. You can sit back down in your chair if you were standing up for that activity. Here in a minute, we'll talk a little bit about weight-bearing activities. Many people are sent to me by their physicians to talk about weight-bearing exercises, and you can see from the list here, that's only just one thing of the list. The third thing is strength and strengthening exercises, and I'll give you some examples of that, and I know there are some questions about what we call exercise prescription. How heavy of weights should I be lifting? How often? How many times? I'll go into that as well. And then balance, which we talked about briefly. And importantly, cardiorespiratory activity is very important for our bones. So Beth, if you'll take us to the posture slide. Oh, you can flip to the next. This is where we're working on our posture. So this is to reinforce what I was just talking about. The picture of the woman, same woman, but the picture of her on the left is what we consider neutral spine posture. So if you could envision her standing against a wall, you would see that her buttocks, her shoulder blades, and the back of her head would touch the wall. What we usually see, however, and which many of you may have figured out, is that when you stand against the wall, those things aren't always touching. So we want to be very, very mindful of our posture, because when we're forward head, as the example here on the right, it increases our risk for compression fractures. Patients that work with me individually get very frustrated because it's a hard habit to break. We spend the majority of our time during the day folding forward. We're on our computers, we're on our phones, which are terrible for our posture. We're reading, we're driving, we're eating. All these things make us round, 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 round. And we end up with the posture like the picture on the right. So just know that it takes a little patience and practice to reform a habit of standing up correctly. Strengthening the muscles on the back of your shoulder, around the shoulder blades, will also be helpful, and I'll walk you through that as well. This other term here, body mechanics. So this posture is great but it doesn't do a bit of good if all you do is stand up against a wall, right? So what we need to do is to translate this nice posture from the wall and take it to all of our daily activities. I think about things around the house that are really risky for this, not ideal posture. Things like loading and unloading the dishwasher, right? Because you tend to fold forward. You need to do that with a more straightened back, using those hips and your knees to bend and flex more than the spine. Another difficult one around the home that I get asked a lot about, getting clothes from the washing machine to the dryer or in and out of those places. There's a lot of bending and twisting that can go along, and we don't want to do that. We want to rely more on our hips and knees to bring us down to the level of our work. Next slide, please, Beth. Okay, so weight-bearing activities, which is what everyone thinks they're coming to see me for in the first place, but really it's just a small part of what we'll talk about. Weight-bearing exercises are very, very important. And when I say this to patients, they get really wide-eyed and say, oh, no, 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 that sounds like that would be awful on my knees. That would hurt my hips. I don't want to do that kind of stuff. And there's a reason for that. This idea of weight-bearing or impact feels a little too much for the joints. So this exercise, this schematic drawing right here, is for an exercise that I give to all of my patients. There's great research associated with this simple activity to actually improve bone density, bone health. It's called the heel drop. And as is shown here in the example, you stand behind a chair or fingertips on a countertop in the kitchen or the bathroom, and you simply raise up on the balls of your feet, and then you drop down. And you want to do this with some impact. So you don't try and gently land. You want to kind of hit with some force. That's what gives the bones the stimulus that says, hey, we need to step up our game here and get stronger because there's this impact. So everybody at some point give this a try because this is a great exercise. The recommendation, the research shows us that people that participate in this exercise doing about 50 heel drops in a day, that'll take you about 90 seconds. I know I've timed it. That can improve your bone density. So heel drop, it's safe for your knees, safe for your hip, and shouldn't bother your back and neck. But I will tell you, maybe start out with 10, make sure they feel okay. If 10 feels okay, try 15 or 20 and slowly build up to 50 in a day. Beth? Great. So strength training. This is where we go into a lot of detail. Some of the best research that we have about bone density and improving bone health with exercise, strength training exercise, comes out of Australia. A lot of good research studies have been done that help us to know what's the proper exercise prescription. Now, I want to be very careful here because if I were sitting with each of you individually, I would tailor this to you, how your DEXA scan looks, how your bone health is overall, and what your current participation is in a strength training program. A lot of patients that I meet with have never done any kind of strength training before. So I would not start them out lifting heavy or even start with weights. We might start with resistance bands or body weight exercises to kind of build that baseline. So when we're in a group setting like this over a webinar, just know that these are very general recommendations, and really I would very strongly encourage you to get with a qualified personal trainer or a physical therapist to get some individualized instruction, fine-tuned to be specific for you. But I will tell you what the guidelines are. And it's heavier weights than most people are lifting. So I love when a patient comes to me and says, yes, I'm lifting weights. And I say, tell me more about that. What are you doing? And they'll say, well, I go to my exercise class and I pick up a 2-pound weight and I do all kinds of exercises with a 2-pound weight. And my response is, that is fantastic. That's a great starting place. But that light of weight will not change your bone health or your bone density. So we need to build on that. When people are very skilled and they have the good body mechanics for lifting weights, and I know that they're safe and they're doing what they need to do with a good understanding of how to execute the exercises, I advance them to the point where they're doing 3 sets of 10 repetitions or maybe even fewer repetitions. Now that might seem a little backwards, fewer repetitions, but here's the secret. The weight has to be heavy enough that ninth or 10th or trying to do 11 repetitions is really, really hard. So for example, I mentioned the patient that would say to me, well, I'm lifting 2-pound weights. Well, they could probably lift the 2-pound weights for 20 times or 25 times or 30. But if I had them pick up an 8-pound weight, they might only be able to lift that 10 or 12 times. So the weight has to be high enough that doing 10 repetitions feels difficult and you would have a hard time doing an 11th repetition. So now you can see why I'm being very particular about being very careful with this, because when we start lifting heavy weights, we got to make sure that your technique is perfectly spot on. So the exercise prescription is 3 sets of 10 repetitions. And for my really advanced people, I go as low as 8, sometimes a little bit lower, but 3 sets of 10 is a good place to be. Doing this probably 3 days a week. The research shows us that twice a week probably maintains our bone density, which is good. 3 times a week is more likely to help improve our bone density. So I shoot for 3 times a week myself personally. Some weeks it gets crazy and busy and I only get 2 in, but that's okay. I really shoot for the 3. Beth, next slide, please. Oh, actually, you can go back. I thought I had a slide about this, but I didn't. I'm going to give you the list of the 5 exercises that are most researched. And some of you that are strength training right now might be familiar with these. If you aren't, don't worry, but this is an example of why you need to meet with someone that knows exactly. But I have all my patients do some sort of a pull down exercise with their arms, either like a lat pull down or an assisted chin up. A couple of different ways to do this. The second exercise is rowing, not the cardio rowing machine, but a seated row or a bent over row. The third thing is a chest press or a bench press. The fourth thing are squats, and the fifth thing are lunges. So if you're going to an exercise class and you're lifting pretty heavy weights and you're doing good, make sure you're well-rounded in getting those 5 exercises. We can look at the research to know that those are actually really helping us make a change in our bones. Okay, Beth, now the next slide. And then I alluded a little bit to balance exercises. Balance is super fun to work on. Love to do balance stuff. And I kind of hinted at that Tai Chi and dance are our best things. But I will tell you, you just need to be doing something that challenges your balance a little bit. And by that, I mean it's something that pushes you a little bit out of your comfort zone, but not so much that you would fall, that you have to react a little bit and pull your body back over your center of mass. It's amazing how many people come to me and say, oh, yeah, my balance is perfectly fine. And then I ask them to stand up and to stand on one foot and hold that for at least 10 seconds. How many even young patients that I work with are unable to do that? So that's your little test that you can do for yourself, is to stand up, stand on one foot, maybe put your fingertips down on the counter in front of you so that you don't fall over, and see if you can hold that for 10 seconds. You will find that one leg is a little bit stronger than the other, and so maybe you need to work a little bit more on your side that isn't quite as strong. So have fun with balance, just don't fall down doing it. Next slide, Beth. Super important part, and many of us in Jackson get a gold star on this part. Our skeletal system has a circulatory system need that comes from the heart and lung as a pump. So the skeleton itself doesn't have a pump that sends nutrition and hydration to the bone and carries waste away from the bone. That comes from our heart and lung system. So the bottom line, bare minimum that you need to get of cardiovascular exercise for your bones, this is not for heart health, this is for bone health, is at least 150 minutes in a week. That's about a 20-minute brisk walk every day. And to help our bones, it needs to be moderate to vigorous in intensity. So depending on the speed that your dog walks, a dog walk may or may not cut it for you. So it needs to be brisk pace. So think a little bit harder than you might want to go for too long. And I want to be really clear here that walking is not a weight-bearing exercise. Walking is not a strength training exercise. Walking helps because of the circulation. So I have many patients come to me and say, well, my bones should be fine because I walk all the time. That's helping the circulation, which is good for your bones, but it's not building that bone density. It's just not enough of an impact like that heel drop exercise is that I shared with you. So 150 minutes a week. It can be any type of cardio, walking, hiking, Nordic skiing, cycling, anything that's continuous and uses the large muscle groups of your body, rhythmically. Next slide, please, Beth. So to tie a bow around this conversation, there are certain types of exercise that we know the research confirms are very, very important for our bone health. But remember, it's not simply our bone health, it's preventing fractures. And working on these 5 different areas that I talked about can definitely reduce your risk of hip fracture and compression fractures. And it, will improve your bone health as you go along. And the whole point of that is to do the things that we love, to pursue our active lifestyles and be healthy in doing that. So, Beth, I think, is that the last slide? Or if it is, we can leave it there. And so Beth now is going to scan the chat or the Q&A. Beth, I do have a list of some questions that were submitted beforehand. So while you're looking at that, I'll just look at these quickly. And I think I answered many of them. Oh, this is a great question. So weighted vests, this is in the media a lot right now. These are, you can buy them on Amazon. They are they're smaller and more fitted than a backpack, but they kind of go over your shoulders and they snap in front and go around your back. And the push with these weighted vests is that they increase your bone density. So the research on this is mixed. Some studies say maybe they help, some say maybe they don't. So my recommendation to my patients is if you want to wear weighted vests, have at it, but be a little careful. If you put on too much weight, it's just like carrying a heavy backpack if you're going on a hike. You can, make your shoulders unhappy and your neck unhappy. So most patients I'm working with are maybe wearing 6 or 8 pound weighted vests. How much that's going to change your bone density is probably pretty minimal. So if you want to wear one and it doesn't bother your shoulders and neck, fine. It does give you a little bit more of intensity with your cardio. But if you think it's changing your bones significantly, it probably isn't. So I think I got that one. Another question about, I got a question about medications, and I'm going to save that for your conversation with your provider individual, because there's a lot of conversation that needs to happen with bone or with medications. Same thing, I'm going to kick the can down the road with collagen. I have a question about collagen, protein powders, and protein intake. Have a conversation with your healthcare provider or a registered dietitian, because those are very individualized questions. Yeah. Another question I got was how often to have a DEXA scan. Most providers or most insurance companies, including Medicare, will pay for a DEXA scan once every 24 months. Other insurers might pay for it more often if there is a clinical indication, like someone that's maybe had oncology cancer treatments or has been diagnosed with a parathyroid problem. But once every 24 months is kind of our general rule. And I think I got that list, Beth. So what else have you got?
Perfect. Here's what I've got. On the heel drops, do you end up with your toes raised? It looks like it in the diagram.
Yeah, great question. So the diagram shows you drop on your heels, and in doing so, you kind of lift your toes up so that the impact goes through your heel bone. So a little bit of a lift with your toes. Yes.
Great. The next person says, and this is pretty specific, this person says that she did a DEXA scan, femoral neck T-score of negative 0.7,
Okay.
a Z-score of 0.4,
Yep.
and then BMD of 0.775. Should I be worried?
No, probably. I'm hesitating because it depends on other health parameters and the age of the person that we're speaking about. But that 0.7 T-score means that you have normal bone density. If it was minus 1.0, we would start to get a little worried about low bone density. So a minus 0.7 is looking good. This also brings up a question I get asked a lot too, that we get on our DEXA scans, we get a T-score and we get a Z-score. The T-score is comparing your bone density to the gold standard, which is the bone density of about a 30-year-old woman. She has the highest peak bone mass she's ever going to have, and that's what we're compared to. The Z-score compares you to women of your same age. So that's why her numbers looked a little bit better when she was compared to her age group. And please follow up with that
Great.
question if I didn't quite get it.
Here's another one, Nola. It says, can you please repeat your recommendations for calcium supplementation for women? Should this always be taken with vitamin D and vitamin K?
So the recommendation is postmenopausal women is 1,200 milligrams a day, premenopausal women about 1,000 milligrams a day. For men in this age, same age range, about 1,000 milligrams in a day. Vitamin D needs to be consumed within the same day. It doesn't have to be taken, two things taken at the same time, but you need to get 1,200 milligrams of the calcium in a day and, 2 to 5,000 milligram or international units of the vitamin D3. The vitamin K, you need to be a little bit careful there because it is a part of a blood clotting factor. And unless you know that you are deficient in vitamin K by way of a blood test, I don't think it should be supplemented. You should get your vitamin K needs through dark leafy green vegetables instead.
Very good. There's no more questions at this point. We can wait another minute until someone has a question.
You bet. And while you're doing that, Beth, I will just also add that if anyone would like to have, to see me individually, I would just need a referral from your primary care provider or your endocrinologist or your whomever you're seeing. And it's a service that your health insurance will pay for. I usually see patients between 2 and 3 and 4 visits to go into more detail with the information that I provided today, and then to tailor an individualized program to you that you then go take to either your gym or do a home program or, work in your own setting. So happy to do that. And I think, Beth, if you want to drop my email into the chat or the Q&A as well, you can certainly email me if you have questions and would like to know more information. But that's how you get in to see me, is get your provider to send me a referral, and I'm happy to meet with you one-on-one because there's a lot of
Great.
nuanced things here.
Great. Here's 2 more questions, Nola.
Sure.
Do risk thresholds associated with different Z scores and T scores vary by race or ethnicity? For example, is a T score of -1 more dangerous for Asian women than others?
This is a fantastic question. So, and maybe Beth, you can put this in the Q&A. So there is something called a fracture risk calculator. The website for the one that is most globally widely recognized is called Frax Plus. The website is fraxplus.org. Frax Plus. It's a fracture risk calculator that was created by the University of Sheffield in the UK. And your provider should actually do this calculator to determine what is your personal risk for fracture. So some of the elements that you would personally put into this fracture risk calculator include ethnicity, because different ethnicities, different backgrounds have different bone structure, different bone architecture. So the T-score, the -1.0 for low bone mass is the same, whether it's Latino bone, Asian ethnicity, Northern European. But what it means is that you may have lower bone mass kind of out of the gate. So when you go to the Frax Plus calculator, ethnicity is one of the things that you put in. And in fact, it's so specific, it asks you your ethnicity and your location. And if you say North America, it wants to know, are you in the US or Canada? So it's it's really good. You'll put in your height, your weight, your age, your gender, your personal fracture history, family fracture history, a bunch of other numbers. And then when you hit calculate, it gives you your personalized fracture for risk over the next 10 years in a percentage. And it'll take you less than 10 minutes to run it. So, and you don't have to put your email in or identify yourself in any way. So to answer the question about, yes, ethnicities definitely have different bone structure. The risk is still associated with many lifestyle factors like smoking history and alcohol consumption.
Great. Do you take Blue Cross Blue Shield of Wyoming?
Yes. I mean, the
Okay.
hospital does.
Yeah. And someone asked, can you please repeat the 5 types of exercise that you recommend? And I'll
Oh,
type them in the chat here.
you got it. The first one is a lat pull down. And there are lots of different varieties on how to do this, but lat pull down. The second one, Beth, is rowing. Third is a chest press of some sort. Fourth is squat. And fifth are lunges.
Perfect. Thank you.
Thank you. And then another question that came in on my end is about stretching exercises and how they help with bone health. This is an excellent question. When I showed you the 2 pictures of the woman with good posture and then when she was not having great posture, and I mentioned that by having stronger muscles in our back, which is what we get from those first 2 exercises I gave in that list, that helps to pull our shoulders back. But if we're really tight across the front, that's just going to pull us into that rounded posture. So stretching exercises for the anterior part of our trunk and for different areas in our legs are very important for reinforcing that good posture and getting us out of that forward folded rounded posture. The old word for this used to be a dowager's hump, getting us really far forward. So stretching is very key as well to be tailored individually.
Here's
Anything?
another question,
Yeah.
Nola.
Mm.
Yeah. This person says, I had a normal DEXA reading in my hips and spine, but have now had 2 unexplained stress fractures in my foot. Is it possible for the usual DEXA scans to be missing increased risk in my foot that is more localized than what is looked at with a typical scan?
Okay. This is a really interesting question. I have patients that sometimes come with normal bone density in their spine by way of DEXA and osteopenia, low bone mass in their hip. Generally, we think of low bone mass as a systemic problem, meaning kind of all areas of our bones are a little bit lower or are normal. But you can have different areas in your body that are measured a little bit lower. We don't measure in the foot. There are some DEXA scans that will do like the wrist, and I've seen them in the heel bone. There's just different approaches, but the best researched are the 2 places in the hip and the spine. However, stress fractures are not, they can not be associated with low bone density. They can happen in somebody that has a perfectly normal T-score. That is an overuse injury, and that can happen in people that have normal bone and low bone mass if the mechanism of injury is significant enough. Well, here's the reality. Half of the hip fractures, remember I told you how scary hip fractures are? Half of those happen in people that have normal bone mass. So having a diagnosis of osteopenia or osteoporosis is not a guarantee of fracturing. And having normal bone doesn't mean that you won't fall down the hill skiing or fall off your bike and not fracture. So the stress fractures may or may not be related. Yeah, I don't know if that helped or that confused, but yeah.
No, I think that was helpful. I don't see any more questions right now, Nola.
Okay.
I did put your email in the chat. I put the 5 exercises and then the Frax Plus website as
Okay.
well.
Awesome.
Yeah.
Perfect. And I'm happy to answer questions or meet with people individually because I know there's a lot of very specific questions and I'm happy to address those, one-on-one.
Here's another one as we're visiting Nola.
Mhm.
This person says, I was told not to do spine twisting exercises or sit-ups because I have osteoporosis. What are your thoughts?
Okay, so I'm going to turn this back on the person that posed that question, our anonymous question. So I just told you that we really want to get out of that rounded posture, right? Because it's increasing our risk for compression fractures. So when we do like a curl up or, a crunch or a lot of rounding exercises, we are just asking for compression fractures. So twisting is of that same kind of mechanism. We want to avoid the forward folding like in yoga. A seated forward fold is not as problematic as a standing forward fold. But if I had osteoporosis, I would really minimize, I wouldn't do that. Same thing in Pilates. We tend to do a lot of, we think of that idea of scooping and that rounding, rolling like a ball and those things like that. We have to be really, really careful. I want my people with low bone mass to be open and stretching the front and strengthening the back. So I try to minimize rounding as well as twisting positions or exercises. Pilates is great, yoga is great, but you've got to be really careful about those things because I have had patients personally that have gotten compression fractures from yoga and from Pilates from not being careful. Great, great exercises, just have to be careful.
That's a good question. I have a question.
Mm.
Af Depending on how many pregnancies you've had in your lifetime, does that affect your bone mass density?
You know, that's a really interesting question. We didn't talk about this today, but I can certainly throw in my thoughts here. So during pregnancy, we are exposed to a great amount of estrogen, right? One of our hormones that is really, we have a lot of it during pregnancy. Estrogen improves bone density. Uh, as we transition through menopause and our estrogen, unless we're replacing it with hormone replacement therapy, our estrogen declines significantly and quite drastically in a short period of time. That is when we see low bone mass become a big problem. So one could theorize that the more pregnancies you have, the more estrogen you're exposed to over a lifetime at a higher dose. Um, the statistics don't totally bear that out, but there is some inclination to think, well, the hormones you're exposed to are setting you up for a higher peak bone mass earlier in life, so that when we hit menopause, we're starting from a higher point because of the pregnancies. The possibility is there. Oral
Interesting.
contraceptives that, obviously contain estrogen are also, they preserve our bone mass. So that's kind of the same thinking. Does that help, Beth?
Okay. Yeah, it does. Thank you.
And the other thing I'll say too about pregnancy is that we do know that people that have higher body weight are less at risk for low bone health, right? It's just, that's why the weighted vests, we think, well, if you weigh more, your bones will be healthier because you're weight bearing all the time. And so pregnancies, add a little weight to our skeletons, our frames, and may be helpful with that as well.
Interesting. Yeah, wonderful.
Mm,
I don't see any more questions.
okay.
Wow, this was wonderful, Nola. This was just fantastic. Thank you so much. Just from all of us. And thanks to all of you for joining us. This is our first time doing this. So thank you for your patience with us in the beginning. It's just hard presenting when you don't have any feedback that it's working. So thank you. Like 10 of you said, yes, I can see you and hear you. So thank you so much. And I just hope everybody has a great day. And again, we'll send out this recording. You've got Nola's email there. I'll give you a minute to write those things down here before we exit. But just grateful for all of you. Nola, any last words?
Thank you, everybody. I really welcome the questions, and I'm so glad you were all here. And maybe next time we'll see each other in person.
Great. Thanks, everybody. Have a wonderful day.
Bye.
Bye.